Welcome to another episode, and today what we're talking about is how to use clear trays that move your teeth. A lot of times people will refer to it as Invisalign, but that's kind of like saying, I need a Kleenex, right? So Kleenex is one brand of tissues, but there's multiple brands that make tissues. And now at Cooper Orthodontics, we're actually making our trays in-house. We're 3D printing the staged models and making the trays here so that you can get them faster and we can cut out the middleman and still give you the highest quality treatment at a reduced cost. So let's go over how to take care of them. The first thing is keeping them clean. You gotta keep your teeth clean and you have to keep the trays clean. The great news is once you take the trays out, you can floss and brush normally. So it's not quite as difficult as with braces. You keep up your normal flossing and your normal brushing. Use mouth rinse if you want, but that is something that is a little bit extra. So the next thing is making sure that you put your trays back in anytime you're done eating or drinking, and you keep them in all day, every day. The next thing is making sure that you take your trays in and out efficiently. You always want to practice taking your trays out and putting them back in before you leave after your first appointment. Because that first appointment is always a little bit crazy. You have cheek retractors on, your teeth you're trying to keep your teeth dry, and you're getting these little tooth-colored bumps called attachments. These attachments are just made from filling material, but it's put on the outside of the teeth. And these attachments will actually give a surface area increase where the plastic can push. Because the plastic pushes on the teeth, either to move them out or pushes from the side to rotate them, and the attachment, Today we're going to talk about how to take care of aligners that move your teeth. So most of the time people call this Invisalign, but that's kind of like saying, hand me Kleenex. And here at Cooper Orthodontics, we make our own clear aligners that are not Invisalign brand, but are 3D printed and then made here in-house so that we can give you the most efficient treatment. The first thing to know about trays is that in order for teeth to move well, you need to keep your teeth and the trays clean. Luckily, with clear trays, you take the trays out and then you can floss and brush normally. You still want to get the floss up in between the two teeth, hug up and down, and then hug the other way, up and down, up and down. There are videos on our website that show this, as well as multiple YouTubes, but it's super important to get that technique down. You also want to be brushing and flossing your teeth 2 to 3 times a day, even with clear trays. So you want to keep them clean because when those trays get that fuzzy film on them, that can actually affect how fast your teeth are moving and slow them down. The next thing is to make sure you can get the trays in and out. Make sure to take your trays in and out after that first appointment with your orthodontist. You don't want to get home and not know where to kind of push and pull on the trays. I have never seen a retainer or a tray get stuck in somebody's mouth totally. So make sure you know how to take that in or out. The next thing is the attachment. So a lot of people don't actually know this because it doesn't get advertised by Invisalign, but 90% of treatments need attachments, which are tooth-colored bumps that give more surface area for the plastic to push on so that your tooth can move in the right direction in the fastest time possible. And that's what gets bonded on at treatments. So this is why DIY aligners and things like that might compromise your results because you're not getting those attachments. The other thing that happens a lot is called interproximal reduction, and it's kind of a diamond impregnated strip or disc, and your teeth actually get slenderized just a little bit. It helps hold them in place afterwards because they have more surface area to rest against one another, and it also makes space where there was no space for the tooth to move into. So those two things will happen throughout your treatment probably, here or anywhere else. So it's just something to be aware of, that it does happen. Eating and drinking with the trays. So there are a lot of people that will try and push those boundaries, but here are the rules. Do not drink anything that has any sugar in it or acid in it, and don't drink things that are dark. So if it has sugar or acid and you're drinking it with the trays in, you're going to get cavities. And then after you spend months moving your teeth in these trays, you'll have cavities to go get filled, or you'll need veneers or something like that. So do not drink things that are sugary or acidic. That's sports drinks, that's milk, that's juice, that's energy drinks, that's soft drinks. So don't do those things. Then the other rule of thumb is don't drink anything that's dark, like Coke, tea, red wine, coffee, because these will actually act as the opposite of whitening trays. And you definitely don't want your clear trays that are supposed to be moving your teeth into a beautiful position to be a darkening tray. So do not do that. The last caveat is don't drink hot liquids with your trays in, because it may actually cause the plastic to deform. So definitely take your trays out for that. And really, that doesn't leave very much for you to drink with your trays in other than water. So that's always the best, to drink only water with your trays in and take them out to eat or drink anything else. All right? So that's how you handle it. Now let's talk about Let's talk about, speaking of trays acting as the opposite of a whitening tray, people ask all the time if they can whiten with the trays in, and the answer is yes. Carbamide peroxide and hydrogen peroxide are both active ingredients that whiten your teeth. It's the same active ingredient whether you get it at the dentist's office. It's the same active ingredient whether you get it at the dentist's office or at the drugstore. So look for something with hydrogen peroxide or carbamide peroxide. You can usually get them on Amazon, and they're safe to just go ahead and put in your Invisalign trays. Some people will ask if it will actually whiten underneath an attachment, and the truth is it does. It actually does whiten underneath an attachment. You won't have a little attachment shaped spot that did not get white. So, what about attachments falling off? Attachments rarely fall off, but if they fall off within the first 24 hours of them getting bonded, then something happened in the bonding process. Just call your orthodontist, they'll get it back on. If attachments are just gradually falling off over time, kind of randomly, then we really need to look at what's going on. If it's a nighttime habit, if it's something you're eating, if it's the way you position your teeth when you're stressed out, kind of grind on it. But it is rare. So definitely if you're having an attachment fall off, check with your orthodontist. It does not always have to be put back right away. Sometimes the tooth will move without it and there's no need for you to go in. So each orthodontist will have a different way of monitoring that. Here at Cooper Orthodontics, we just kind of watch on dental monitoring because all of our patients are scanning at home. And as long as that tooth is moving how it should be moving, then we don't make you come in to rebond that attachment. Okay. Last thing that happens, trays are not fitting. If the tray is loose when you first put it in, call your orthodontist, because this is probably a sign that we need to add attachments or we need to remake the tray or something. The tray should not be like loose and kind of bouncing. Either that or you've moved into the tray too soon and there's no way the tray will actually seat down on your teeth well. Okay. Then if your tray is really, really, really tight, that's when possibly you need to wear the prior tray longer and your teeth have just not moved into the spot where it's ready to move into the next aligner. Now this used to be kind of a constant problem without dental monitoring because some patients would move through their trays pretty quickly, thinking like if I just move through them, I'll get through the treatment faster. And other patients would kind of sit in the trays a long time and the trays would wear out. And so it was hard to control that. Now that we're monitoring from home and our patients are scanning in usually about once a week, we can really help you with that process, and the trays normally fit really, really well. So it's really revolutionized our clear tray treatment because we can actually monitor our patients from home. So let your orthodontist know if you're having any tray fit issues, and if they're super tight, another little trick is to use Chewies. You can order them on Amazon. I don't know if you can get these in the drugstore, but definitely you can get them on Amazon, and you can get them from your orthodontist. And they're just plastic little round cylinders that you can put in your mouth and chew on them. And some people like to chew on them like gum, and it doesn't hurt your treatment at all. In fact, it could actually help it a little bit. Just seat the tray all the way. So that is how you take care of your clear trays and how you wear them, as well as the different guidelines for eating or drinking without the trays in, and how to take care of your teeth. So that lets you know how to take care of it. And what's so great about clear tray treatment is that it's all up to you. It will go well if you're following the instructions and wearing your trays. Your teeth will move, and you'll end up with a beautiful smile.